So we are in a good place in Australia with our vaccine strategy. Of the 4 vaccines that we did advanced purchases on, 2 are probably the most advanced in terms of phase 3 data and likely to be or already are registered in other parts of the world. We went into this with the potential that none of the 4 might actually get through to the clinic. That's why we had the COVAX facility to back us up. So to have full population coverage of 2 vaccines and local manufacturing of one of the most promising vaccines so that we can guarantee we'll get it when we need it. And we've got also that wonderful position we are in Australia where we can take our time to do the proper regulatory and go through our normal regulatory process. We don't need emergency approval. We're in a good position because we've controlled the virus. So I'm very confident now, very confident about the successful vaccination strategy that we'll be facing next year. Clearly, the discontinuation of the UQ vaccine by mutual agreement, it was likely to be a promising vaccine. It was likely to work, but we knew that we didn't want to have any issues with confidence, and this false positive test may have caused some confusion and lack of confidence, but it was a very, very good technology. It was looking like it was going to make antibodies, and it probably would have worked very well as a vaccine, but we can't have any issues with confidence, and we are, as a nation now, with a good portfolio of vaccines, able to make these decisions to best protect the Australian people. I'll leave it for questions.
Results, if you will, right at the beginning of trials. So this has been known about CSL for a long time. So why decide to pull the pin now after hundreds of millions of dollars have been spent?
So I think the risk of actually getting a false positive was seen to be extremely low at the outset, where everyone was very surprised at the unexpected prevalence of the false positive. It's only a small portion of the HIV protein that's in the vaccine as a molecular clamp. The modelling at the time thought it was a very low theoretical risk on that basis. That's why the people were informed of that risk. But it was very surprising to CSL and UQ, the incidence of the false positive. So it was very unexpected.